topic of energy medicine and how it really applies in day-to-day life. I want you to hear from somebody who's entrenched in the medical model, but also understands the energetic model and how that is his passion. Please help me welcome Dr. Jeff Audibert.
Hi everybody, my name is Jeff Audibert. I've been a medical doctor for almost 35 years, and I've worked full-time in anywhere from 1 to 3, 4 ERs at a time over the last 32 years. About 19 years ago, I was at a Tony Robbins seminar, and I was helping with any medical issues. For about 19 years now, I've led some medical teams for Tony Robbins at different events that he holds. And I usually have, back 20 years ago, we were in Hawaii, we were in Maui, and different places, and it would be me and a nurse or me and a medic taking care of thousands of people. So if they had needed a Band-Aid or sprained ankle or vomiting. So I've been doing that for many, many years and keep doing it now. In the process of doing that, I met a lady who wanted to come with me and see what I was doing. So I was going to see somebody that at the time had bronchitis. I didn't know until I talked to her. And after I did what I was medically did and was going to prescribe some antibiotics, she said, do you mind if I do what I do? And she was doing energy healing. The specific modality she used was called pranic healing. And it's very cool, very good, works really well. And how many of you know about energy healing or energy medicine? Okay. Do any of you actually practice or do energy healing? Okay, cool, cool. There's many, many names, as you know. Energy healing, energy touch, quantum healing. The Japanese and Chinese call the inner energy chi or ki. The Hawaiians call it prana. And we all have it. We all can heal. There's no special, like, you're the only one that can heal, or I'm the only one that can heal that thing. We all can do it. We're all born healers. Some of us just don't go in that direction. Like, some of us become chiropractors. Some of us become doctors. Some of us become, other things. So, energy healing is actually easy. Anybody can do it, anywhere, anytime. So, if my mom's got eye problems in Maine, I can heal her from here. No, not a big deal. So when you folks hear the word energy healing or energy medicine, what kind of questions do you have, or what do you think about it? Good stuff? Yeah.
So
right.
It's a different, we're gonna kind of talk back and forth up here. It's a different feeling than the technique that we're using in technology is, if you were talking about the medical model, and then we have this best healing model, which involves energy. And then we're talking about another model here that doesn't even involve touch. It involves projection and dealing with the energy fields that are out there. So it's just another aspect. I want to make sure we're clear on the terminology, because most in here would say, well, I do energy healing because it's such a soft touch with what we're doing. But this is just another, I'm going to push you a little bit. We're going to ramp it up a little bit higher today, get you out there into the ozone, the woo-woo, and hear from some credible people that have had wonderful experiences with this. So when you ask about, what do you know about energy healing? You may not know much about it, and that's okay too. But if you do, does anybody have an opinion or a preconceived idea about what energy healing would be, or just open to?
One of the things that I observed with energy healing, whether it is telepathy or whatever you call it in medicine, you don't hear that much about it. It's something that's brand new, and I don't think, at least in my show, I would even know what to ask, because I don't even know what it is.
Right.
Is it brand new?
Well, telepathy, since I was a kid, I heard the word telepathy. And part of what we can all do comes from intuition. Some people see, some people smell, some people feel. I don't do any of those things. I just have a knowing. Just a knowing of something to do, something to treat, something to heal. I first learned something called pranic healing about 19 years ago. And it was originated by a Filipino engineer. So it was very rigid, very structured, and it was great. I mean, you used colors, you cleaned up the energy, you brought in energy, and the energy comes from whatever you believe in. So if you believe in God, or Jesus, or Allah, or Krishna, or universe, or source. It doesn't matter what you believe in, it still works. And so I did that for many years. And just recently, last fall, even though I've been doing this for a long, long time, I've got really massively increased awareness, intuition, and awakening just recently, last several months even. And so, but it's not anything special for me. It's something we can all do. And that's what I really want to pound on. It's not just something special that I do. I'll tell you some stories of things that I heal that are amazing, but not because I'm an amazing healer. But I just receive, I'm open. And when I first started, I would get the energy from the universe or God. It would come through one of my hands, and I was just a conduit or a vessel, and it would just go out the other hand. And then just recently, and then I've studied different methods also. There's something called ultra-high frequency healing, which is very similar to the pranic healing, but pranic healing was so rigid. I love pranic healing, and it worked really good. I thought, okay, it's got to be simpler than this. We don't need to have all these rules and rigidity. And so then all these other things came to me. I read some books about quantum touch and quantum healing, and then recently learned something we call Instant Miracle. And Instant Miracle starts from, for me, it may be different for different people. For me, it starts here. Because this universal energy is inside of us. It's not just outside, it's all inside, it's inside of us. So now I don't have to get it from out there, it's already here. So the Instant Miracle just starts here, and it just wells up in me, and it just comes out through, and it comes out like a breath. And if people didn't know, they just think I was yawning, or wasn't paying attention or something. Sometimes it's a bigger yawn, and sometimes if I'm in the middle of people, I don't want somebody to notice, I just kind of stifle my yawn, kind of like you stifle a sneeze or a cough. That's kind of how I do it just in public, so nobody even knows. And I could be driving by and see somebody limping and send them an Instant Miracle. It takes a half second or a second or two. Everybody can do this. And then I've had people that came to me just a few weeks ago. I was invited to a gathering. It was similar to this, except there were maybe two-thirds of people. And I had some products that I was sharing with people. And one guy comes up to me and says he's got really bad pain in his posterior iliac spine. And he's got pain every day. He gets physical therapy for it, takes medications for it, and treatments for it. And I just sit there and send him healing for about 2 minutes. And his pain went from about an 8.5 to 0 in 2 minutes, and he was shocked. I was working on somebody else, helping somebody else, and I could see him in the other room bending, trying to get up and out of it, trying to make it hurt, and it wasn't hurting him. He just couldn't believe it. The pain was gone. 19 years ago, I was in Hawaii, and one of Tony Robbins' trainers brought this leadership training person to me and said, "Doc, do that thing you do." And so I just sent her energy healing for about 1 minute. And she had the goofiest, nastiest pink eye that I've ever seen, just almost dripping out, red, swollen. And for 1 minute, sent energy healing. And I saw her the next day, and I couldn't even tell she'd ever had it. And pink eye usually takes 3 to 5 days to get worse, 5 to 10 days to get, before it gets better. And it was just gone. And I could tell you hundreds of stories like this. But not to tell you stories about me being a healer, but anybody can do this. So if anybody's interested, you're welcome to connect with me through whatever, Facebook or email or somehow, and we could talk some more about it. But
Dr. Moore, are you going to send an info out in an email?
Oh, no. We'll never hear about you again.
Right.
Jeff, you talked about, we were talking about a process that you were using about peace, I think.
Yeah.
Let's talk about that for a minute.
Yeah.
You guys find this interesting?
Yeah, so I have something called the peace process. It's not my origination. I'm doing some coaching and learning how to run certain businesses with a gentleman named Christian Michelson. He's out of San Diego. He started years ago being a coach and just really struggling. It took him several years to really get the business going. And now he makes multi-millions every year with coaching and healing. And about several years ago, this Instant Miracle came to him, along with the ultra-high frequency energy healing that I told you about, which that, for me, again, I used to get the energy from the universe. Now it just comes from within. And before, where I used to take the energy in one hand, out the other, now I can just do it with both hands because it's just coming from here. So it's just, and I've done different things where I'm healing different people at the same time. And I've healed multiple people at the same time remotely. So the only limitation with this is the same limitations you put on yourself every day in life. If you say, the person across that door, I can't heal him because I can't see him, you're absolutely right. But if you say, no, there's no limitation, then that's the truth. And that's the kind of results you'll get. So it's all about belief. You talk about thought and belief, and you've got to take some action instead of just thinking about it and saying, okay, well, someday I'll learn this. You've got to do something about it. But anyway, there's something called a peace process that's going to be really, really cool. Does anybody here, I know you've been working on a lot of stuff the last few days, have some kind of emotion or something that really bugs you? You don't even have to say what it is. But is it one of you? Okay. So think about that thing, okay? And what I want all of you to do...
Yeah. Let's let everybody have give them a little time here. To think about, you know, a feeling or something. Maybe it's anger, maybe it's something that's come up over the weekend. And this is just another way to address that, to make sure that, you know, we've got it balanced. So just give me a second here to, because I don't want you go fast.
I do.
I got to slow you down. That's why I'm sitting here, slowing down. You said slow me down sometimes, so I'm going to slow you down a little bit, because you can see excitement, enthusiasm, and this is passion. This is what makes people successful. This is what makes you successful as the best practitioner. Even if you don't pay any attention to anything he says all day long, just watch the enthusiasm, the passion, the belief. Okay? That's what this is about, because this is a credible man who's got some great ideas for you. So let's just go deep for just a moment and think about, it was a feeling, a negative feeling that you had.
Something that bothers you, just some kind of feeling. And while you're doing that, you're welcome to close your eyes, and we're just going to slow down for a minute. Just close your eyes and take some just nice, slow, deep breaths in. And while you do that, breathe in some nice, clean, white energy. And notice that feeling you're thinking about, and notice where it is in your body. It can be in your stomach, in your head, in your ear, anywhere. And it could shift over time. It could stay in the same place. It can actually get more intense. So notice it now, and just for yourself, just grade it from a 0 to 10. How strong is it? Is it a 2? Is it a 10 out of 10? And just notice it. And while you're noticing it, and while you're noticing where it is, just send it love. You don't have to figure it out. You don't have to think about why is it there, what's he doing, is this going to work or not. The only thing you need to do is just focus on that area where it's bothering you and just send it love. And as you do that, it might shift. It might shift intensity, it might get worse, it might stay the same, it might get better. Sometimes it changes slowly, sometimes quickly. You just focus on your breath, and through your crown chakra, through the top, breathe in some nice, clean, white energy. And wherever you're feeling that thing that's bothering you, just breathe out the negative energy out that area. And while you're doing that, get really centered, get really grounded, and just imagine growing roots through the bottom of your feet, all the way down to the center of the earth. And then the energy shoots right up through your body again, and then bring in some white, clean energy again. And you may have noticed some shifting or some changing. Suzanne, for you, what's changed about it for you?
Under my heart chakra, and it was like, I could see it go white, and then like a little plant start to grow.
So the intensity got better, worse?
Better.
Better? A little better or a lot better?
Well, like it was gone, and then there's just white love.
Okay, that's great. Some people can heal it that quickly. And once it's gone, it's gone. You've taken care of it. Now what will happen, some people go from a 10 to an 8 to a 2 to a half, and they'll stop. And they'll say, oh, it's good enough. And that's fine. But what will happen is that thing may just come back and bite you in the butt sometime in the future. In a couple of weeks, a couple of months, you never know. So we've just started the process, okay? And when you get home, or tonight or today, you can put it on the back burner. You can do your work, you can listen here, just put it on the back burner. And every once in a while, just have an awareness of it. And just that awareness and sending it love and just noticing where it is, that can keep healing it. I've had things like that. I remember something just pissed me off one day at work, and I said, well, I'm not going to deal with it. I want to wait till I get home. So I got home that night, and when I got home, there was something else. So I laid down, and about a minute or two before I went to sleep, I did exactly what we're doing right here, called the peace process. Just thought about it, just located it, just really tuned into it, sent it love, fell asleep. Next morning, one of the two is gone. Totally gone. And the way to know that it's gone or not is something we call poking the bear. So when you think about that thing, if you think about it again, or any of your things, if there's any little charge or something to it, it's not quite gone. If you feel total peace, you're totally okay with it, it's that simple. Now use this over and over and over again. I had a friend who's actually flying from Massachusetts next weekend to come visit me to help me with some online businesses. And she was getting ready to speak in front of a group. And she spoke to 100 people, a couple hundred, 300 people, no big deal. But she opened the curtain, there's like 1,500 people in the audience, and she just freaked out. She texted me, I'm in the ER. I said, call me right now. She's going to speak in about 20 minutes. So we did the same thing. And in just several minutes, totally went away. She had a great talk, wasn't anxious, didn't freak out because we just cleared it out really quickly. And she'd also had some low back pain on a previous occasion that I had sent her some healing. It had gotten better, but she was having a little back pain again. And usually when she stands for a long time, like cooking or in front of a group, it makes her back pain worse. So she was concerned because she was going to be doing this talk and standing for a while. And then there was going to be a panel with questions, and she thought she was going to sit down and get a break. Well, she didn't get a break. She had to stand the whole time. And I had sent her healing for her back right before that, and she never had back. She's not had back pain since then, ever since then. And again, this is something just anybody can learn to do.
So what are some steps that we could take that you could share? Just some basic steps about how to access this, how to begin this process without whatever it takes to learn what you're talking about. Just some things that they could practice on for the next month or so, and to see if it's really resonates with you. Would you like to know something like that? I don't know, because I haven't asked the question yet. Well, how can we start?
Yeah, I've restarted doing something I had done years ago and kind of got away from. At different times I've done some meditation, transcendental meditation. I do something called, I call it quiet time. I also call it my conversation with God. Because God will speak to anyone. He'll speak to all of us. Most of us don't listen. Most of us don't tune in. Most of us hang up the phone. And so we only get partial conversation. So just set a little ritual. You might take 5 minutes to look at your schedule and say, okay, this is what I'm going to do today. And then just get quiet. Just close your eyes, get quiet, and just tune in. Just listen. I ask God to talk to me. Sometimes I don't hear, and I really get demanding. God damn it, talk to me. and then he says, well, I've been here the whole time. You know, you need to listen. You need to just pay attention. And so that would be a suggestion, something to do. I also start at the end of the day now, I start kind of looking at my schedule for the next day. But I'm talking about 5 minutes. I say, what am I going to do? So your subconscious while you're sleeping is kind of like scheduling your day and working on it for you. As far as actual energy healing, it's just a matter of, there's things you can read, things you can do. Probably the easiest would be something called quantum touch. I can't think of the gentleman who, Richard Gordon is the originator. He's been doing it for 19 or 20 some years. And he's got seminars, and he's got books. You just buy a book and you can do an online course. As hard as it may be to believe, how many people here are chiropractors? Most or some?
No.
Okay. Well, you know, when your bones form, they shape, they cement, they're in place. So people don't think your pelvis is going to shift because it's solid. Okay? And people don't think your skull is going to shift. Well, through this quantum touch, I haven't actually done this. I haven't actually experienced it. He and other quantum touch healers just put their hands on somebody's skull and it shifts. It adjusts. And the same thing with the pelvis adjusts. And people can actually feel it, even though it's supposed to be like solid.
How does this compare to like a Reiki or, I don't know if you've heard of Eric Pearl's
Yes.
reconnection?
Yes.
Is it all kind of the same thing? Is it?
Everybody gets a little twist on it because there's like different forms of chiropractic. Right? There's best and there's multiple other ways. You know, I don't know the names of all the tools, the little jabbers and with the gun, with the computer, you know, there's all kinds of different methods.
Tools and jabbers.
And they're not, they're not that one's right or wrong, they all work.
Pokey things.
Yeah. Right. And you know, many medical doctors have different techniques, different drugs for the same condition. They'll use a whole different kind of medication for it. So my thing, I just call it energy healing because to me, that's what it is. Okay, it's just energy medicine, energy healing. people have their fancy titles and names and certain techniques and tricks, or you stand this way, you look this way, and that's all fine, it all works, but when Jesus stood up and healed people, he just stood there. I mean, he had his hands open. Whether people touched him or not, they got healed. With Reiki, Reiki's mostly touch. I don't know enough about Reiki. I've had Reiki done to me one time, and I remember having just an emotional outburst, just laying on the table. And that was many years ago. And then after that's when I learned. The pranic healing, there's no touch. It's not that you can't touch, but I don't need to. So, some people have...
Well, I think the question I was asking is it's the same energy, but maybe we're just accessing it. This person found it in this form, this person
Right.
I do, but I want to make sure that
It was confirmation. You're right.
I'm looking for confirmation.
You're right.
Thank
He's
you.
right.
Well, that's why I use the words ki, chi, and prana a while ago. It's your life force, your life energy. It's inside you. It's
We
part
all
of
deal
you.
with the same energy, whether you're projecting it, whether you're touching and working with it, whether someone's doing it to you. Remember when we say it's all about energy? That's what that means. It's all about energy, really. And let me get, you said something, and I'm not going to let it slide. We're going to dig into this a little deeper. Because you said that medical doctors will use different treatment regimes and different drugs completely to treat similar conditions.
Right.
How much of that do you think is involved just from the medication itself, or how much of that comes from the belief of the doctor who's prescribing the medication, his belief patterns?
The belief of the doctor, the belief of the patient that it'll work
Yep.
or not
Well,
work.
yes, and or both. I'm going to throw you under the bus here.
Absolutely. Yeah. And
What do you think about that?
well, I agree that.
Or can you say?
Well, I've done things partly experimentally just to see what would happen. And in the ER, about 18 years ago, I had a lady that comes from the Bentonville ER, and she had strong narcotics, pain medicine, nausea medicine, and she came back, she had the same pain, wasn't better. So I didn't give her any pain medicine. She had severe low back pain. I gave her 3 shots of Ativan, which is lorazepam, which is was not even muscle relaxer, it's just a relaxer. And every 20 minutes I gave her a dose, and within the 3 doses, her pain was totally gone, with no pain medicine. So what's that about? And part of it's the energy, part of it, she was so hyper that she couldn't let herself relax and things calm down. And so whether she believed, she didn't know what it was, she didn't know what I was giving her. So she had, hopefully had faith in what I was doing, maybe had some trust and some belief there, maybe that helped, but the medicine actually.
So when we're talking about energy healing and, sending love, sending positive energy to someone to help them heal, do you, one aspect of it is that they don't even know what's going on.
Absolutely.
They have no idea what's going on.
Mhm.
So that kind of takes the preconceived idea about it and me talking you into how this is going to affect you and fix you. It's not about that. It's about being in the moment and then projecting that. It's the same thing Dr. Morter did when he was working with people. That's why he was so confident on what was going to happen. He knew, it's a knowingness. You used the
Right.
word. It's a knowingness. And when he would work with people, when Tom and I work with people, when you work with people, when you got this dialed in, you already know what's going to happen there, and you don't have to tell them about it. They're going to experience it. There's different ways to access different areas of the brain. One's through verbal communication, one's through visual, one's through auditory. There's lots of ways to do this. But when you know it, and this whole program is about engineering your quantum, engineering the quantum, engineering your energy, your tiniest particles, to make the proper choices and decisions and have your body resonate with that. That's why I wanted Dr. Audibert to come here. And, we're friends and we talk about this kind of thing. And I wanted you to experience a little bit more that's out there, another step out there leading into the fire, as they say. But so there's a lot to the belief and of him and of me and of Dr. Morter and Tom and Melissa when she's working with people. And it's almost like when you go into the room, the shift happens. Actually, you only have to go into the room to make the shift happen. That's what he's saying. Dr. Morter always said, when people walked in my clinic, they felt energy, they felt the healing, they felt the presence of God or whatever that was going to be to allow them to heal. And what Dr. Audibert is saying is we can spin that up even higher. And it's not unique to him. He didn't just come up with it.
Yeah.
He's just been doing this for 20, 30 years, and I thought you might like to hear about some of it.
And with what he's saying, you don't even have to show up here. You can just pay for it and sign up for it, and already some shifts can start changing, just from an energetic point of view, from where you're coming from. And with the energy people don't even have to know. They don't even have to be willing. They don't have to understand it, and it still works. For me, it's strictly about intention. I have an intent. They tell me what's going on, and I don't even really have to know. But because of my career, I ask questions and try to find out what's going on. And I think I can kind of guide it because I know anatomy and physiology, but the energy just knows what to do. It doesn't matter what I say, it's just the energy knows exactly what to do. So it comes from with you, through the universe, and heals. And some people only get partial healing. Some people get temporary healing. I've had people in 2 minutes or in 20 minutes be healed and never have it again. And part of it's what we're willing to receive.
So if you're going to shift energy and send healing energy to someone, tell me the process that you're going through. Tell me what you're thinking or what you're projecting.
Right.
I'm sure everybody wants to know. They want to know, like, well, what are you talking about? How does this work?
Right.
Like,
It depends on the situation. It just depends. I try to kind of model what I do to what fits the patient, so it's never the same for anybody because nobody's the same. First, their energy's not the same, the situation they're going through. They may have the same chest pain.
Here we go. This happened. Remember my son Philip?
Right.
Hurt his back.
Right.
And it didn't bother him. We've been working with him, and he got to a point where he was on the floor. And I'm saying, okay, it's time. We're going to get a CAT scan. We're going to get a scan. We're going to see what's going on. Remember this? And we took him to one of your friends, and Philip did the consultation on the floor in the exam room. The doctor kind of smiled at me, and I smiled back. But he could get up and walk for a bit, but he couldn't not for very long. So Jeff said, okay, well, let's get the scan. Let's see what's going on with that. And in the meantime, I'm going to send him some healing energy. Remember this?
Right.
I'm sure you do.
Yes, I do, absolutely. And I've got his picture in my phone.
So tell me
the first thing I
process.
asked him to do is to send me a picture. And I didn't even need the picture, but it was just something I wanted. And so I saw his face. I saw the two of you standing together, and so I could picture his body, and I, kind of knew where his pain. I've had people send me a picture and point exactly where it's hurting. It's hurting right here. Well, it doesn't mean that's where the problem originated. It could have originated here or anywhere else. But it gives me a little bit of knowing what to intend. So I'm intending to heal that specific thing. But I'm not limiting it to that. There may be other things that need to be healed also. So again, so my thought is just the knowing what's going on, having an intention to heal, and then sometimes when I have that thought, I'll have instant miracles will just come up within me that kind of originate from here. And sometimes they just come up, and other times I kind of think it, and then it comes out, and that's just in that second it's healing. And other times, for me, what I do, everybody try this. Push your palms in like this a couple times. Push your palms in here. Put your hands just a few inches apart, and only bring them out to about 12 inches or a foot and a half, and close your eyes and really feel it. Some of you will feel it right away, some don't. I can feel it tingling. And then you can feel like a pushing or a pulling. That's your energy, okay? Between your palms and between your hands. And when I bring my fingers like this, I can actually feel it going from fingers to fingers. And I can actually feel it swirling. If there were lights and colors, you could see the lights and colors of the energy. No such thing, but, and so that's just the energy. And so that's what I do. When I start, we say, what do? I intend, I do this, and I just feel that okay, I'm ready. I can feel it, so I'm ready. And then I'll just send the healing.
So this is what you went through.
That's what I went through with Phil, right. Sometimes I do it once, sometimes I'll do it 3 times, sometimes I'll do it 20 times. It just depends on the situation.
So what are you thinking in the process when you're going to send him healing energy?
Sometimes I will actually ask or tell. Depends. The universe, God, just heal him. You know what he needs. You know what's going on, and just heal Philip. Help him feel better. Get rid of his pain totally, completely. And even just doing that, I can just feel the energy. Mm-hmm. And then that may be all it is. It may be a half a minute or a minute. I just kind of came up with a business name called the 1 Minute Healer, and people say, what do you mean 1 minute healer? Most of what I do takes 1 minute. Sometimes I take 20 minutes, Sometimes I take an hour and 10 minutes. Yes?
I was gonna ask if you wanna do a demonstration with poor Charity that has broken hand and it won't seem to heal and she can't do back treatments right now.
Okay, where's it hurting?
Well, the bone is healed, complementary pain syndrome is added to it.
Uh-huh.
I'm doing this that syndrome.
Okay, how much pain do you have right now, 0 to 10?
It's all sporadic.
Okay.
I can't move.
If you do something that would make it hurt, like right now, do something that'll make it hurt, like bend it, twist it, whatever. When you do that, how bad is the pain?
Well, I'm not gonna push it very far because
Okay.
it's just, I mean, I can make it real painful.
Okay. All right.
Yeah.
So as we're talking, I'm actually, I mean, people see I'm doing this, I'm actually sending you healing right now, as we're talking. Okay, and that's all I have to do. I just have the intention to heal the hand and the bones, and you may or may not feel it. You not feeling it doesn't mean it's not working, it's still working. Kind of like you may feel Ted, moving your legs around, but other than that, you're not feeling internally the energy movement and what's going on with conscious, subconscious. You're not feeling that necessarily. Or when you first got pregnant, if you ever did, you didn't feel the second you got pregnant or minutes later, right? But then you still were pregnant. So sometimes people just don't feel it at all, and that's okay. And it's still healing. Anything else about that?
No, I just, that's why I thought, I know she's been struggling with it,
Right.
and I thought this is.
And for me specifically, I've never asked anybody if they have this or not. Like as I'm sending more energy now, I can actually feel it. And for me, it's like a gas gauge. I can feel like it's half full, 3/4 or full. And in your case, like right now, it's about 3/4 full. To me, what I feel, and now it's about full there. And so then I know we're done as far as for this time. Whether you feel it this second or tonight or tomorrow, who knows? It's all good.
Philip didn't get up off the floor. He's doing well. He's getting married, no wonder his back hurts.
Isn't that your head?
You're not kidding. So, these are the lessons to learn. These are the lessons, to learn the lessons. Yes, sir? You find this interesting? Yeah. I knew you would.
As an example, you get tingling,
Right?
he feels,
When I'm lecturing, I get goosebumps when I say something, and all of a sudden, bang, it's all my whole
Uh-huh.
body lights up. Same thing, same energy. We all have access to the energy. We all can access. Bye, guys, drive safely. Now you gotta go.
Thank you.
Thank you for everything. Thank you for being here. So it's always about energy.
Mm-hmm.
Always. And how we harness the energy and how we use the energy, there's many different ways to do it. Dr. Morter said this. If you look at the library when you're up at the office, if you look at that library we've got in there, where we've recreated from his library, all these books are there. It's all there. So it's not like anyone has the monopoly on this type of work. It's not, it just can't be. And anyone who says they do is more of a guru rather than, which is, I had this intuition, therefore it is true, and you should follow me. Well, that's not necessarily, in my opinion, the best path to take. If you, like Dr. Morter would receive this information intuitively, receive it at night, he would write it down, and then we would go to work to prove it. Not just to say it is truth because it was given to me, to prove it clinically in the office and scientifically, in the research in the colleges. So, it's a whole process that we go through to end up where we are now. This type of healing, this type of energy, all healers use. It's not unique. And Jeff and I were talking about this out here before we started. It's not unique to him or to me or to you even. Some are more focused and more centered in the delivery. Others are more scattered.
Right.
It's just a different type of energy. Anything else you want to?
And just take what works for you. Because he was earlier talking about Eric Pearl. Well, I read his book several years ago, and there's some really good stuff about it, so I grabbed that. There's some things I thought were limiting, and so I just didn't use that. And just take what works for you. And it's not the same. And it may not be the same tomorrow as the same thing that worked for you today. And things will change. You're welcome to connect with me if you want to, if you've got questions or or what do I do about this, or what's the next step I should take here, or if you have any direction you want to be led in. I've read a lot of stuff, I've been to a lot of seminars, and helped a lot of people, and I'd be glad to help you also.
Can I ask, you may not be able to answer this, but do you use this in the ER?
Very carefully and very limited, in a way that people don't know, and I don't talk about it, or minimally. At the end, I was working at one hospital, I knew I wasn't going to be working anymore. I talked about it a little bit at the end, because I knew I wasn't going to stay there, but it's not Western medicine. Most medical doctors, nurses don't believe in this stuff, or don't know about it, and they're all about finding what's wrong with somebody. You know, I ask questions to find what's wrong, so then I can find out what direction to take, what x-ray to order, what blood tests, what medicines to use, and that's Western medicine. And Tony Robbins gave a great analogy several years ago about Western medicine. And the doctor jumps in the water to save this drowning patient, and works hard against the stream, kind of brings the patient, revives the patient. Great, help that one. Turns around, there's another one coming down, drowning in the stream. And he does that all day and all his life. Nobody ever looks up the stream to see who's throwing people in the river. That's Western medicine. So there's some holistic, alternative, new things now. People are looking at the cause. You know, whether it's chiropractors looking at the cause, or medical doctors are looking at the cause. But it's still not mainstream or common, even though it's been coming for years and years, but it's still not common. What was cool, a friend asked me recently about getting into some of this stuff, and I was thinking, why? I don't even need to know the cause with this. I just need to know what, you know, they tell me that the back's hurting or whatever. I don't even need to know why it's hurting. I just feel it. Without having to do a bunch of tests, without CAT scans and MRIs, and thousands and thousands and thousands of dollars, and waiting and time, and, you know, limitations, and
All those positive experiences you have at the ER.
exactly, right. And most of what I've done, I've saved a lot of lives, actually, literally, figuratively. People dying saved a lot of lives. But a lot of what I do is putting a Band-Aid on things. You know, take this pill, go see your doctor, go get checked again. You know, there's a lot of that going on. But, you know, doctors and chiropractors do the best they can. They do the best they can with the tools they have. We're just trained in different ways. And we help people, and I'm trying to just do it in a more natural way. That, again, all of you can do. All of you can do.
It's a great good question for Eastern medicine in the ERs or in that direction. Do they use more energy healing too?
Where? In East?
Eastern, yes.
There are places in China and Hong Kong, you can walk into a hospital and you decide you're going to go left or you're going to go right. Left, Western medicine, you get all the CAT scans and tests, and you go right and you get energy healing, you get Reiki, you get massage, you get all this other natural energy stuff. And I don't know because I've never been there, but I don't think it's that you can't go back and forth, but you know, you decide what do you want. And then you head down that direction. And so,
Doc, thanks for being here.
yeah.
So, you want to give out information on the holding this?
Oh, yeah. My email, probably the easiest way, is my last name's Audibert, A-U-D as in dog, I-B as in boy, E-R-T, the number 2, @gmail.com. So it's A-U-D-I-B-E-R-T, the number 2, @gmail.com. And I've got thousands of emails. So if I don't get to it right away, if I don't get to you in a day, just email me and tell me, you know, we met here, and be glad to answer your questions.
Very good, let's take a break.
Yeah.
I have a